Welcome to the deep dive. Today, we're taking a closer look at canine Fanconi syndrome, a health issue that, well, it can affect our beloved dogs.
That's right.
You're here to get a solid understanding, without getting totally lost in complicated medical jargon,
Right.
and that's exactly what we're aiming for.
hmm
We've gone through some pretty detailed medical info to pull out the really crucial insights for you.
Yeah, boiled it down.
Our goal is to really understand canine Fanconi syndrome, what it is, what might cause it, how you might spot the signs, and what can actually be done to help.
Okay.
And here's something that immediately jumps out. An incredibly high percentage of what they call idiopathic Fanconi syndrome, that's when the cause isn't obvious, happens in one specific breed.
The Basenji.
Exactly, the Basenji. We're talking roughly 75% of those cases.
It's huge.
And even more striking, in North America, estimates are that 10 to 30% of all Basenjis are affected.
Wow.
That kind of breed link really makes you wonder what's going on there, doesn't it?
It absolutely does. That strong connection to Basenjis is, one of the first things that catches your eye with this syndrome.
So what is it, fundamentally?
Okay, so let's get down to basics. Fanconi syndrome isn't just like one single problem. It's more a cascade of issues, a constellation of abnormalities,
Yeah.
as the medical texts put it.
Okay.
Think of it like this. You've got tiny filters in the kidneys, the proximal renal tubules. Their job is to grab essential things, glucose, electrolytes, amino acids, from the fluid that's going to become urine.
And pull them back into the body.
Exactly, pull them back into the bloodstream.
Yeah.
With Fanconi syndrome, these filters, well, they're defective. They're not working right.
Sure.
So those vital substances end up getting lost in the urine instead.
So it's like the kidney has a phlegm with holes that are maybe a bit too big, letting the good stuff slip right through.
That's a really clear way to put it. Yeah, a leaky sieve.
And it's mainly dogs.
Primarily dogs, yes.
Yeah.
And as we said, Basenjis have this really high risk for the idiopathic, the kind of unknown cause form.
Right.
But it's not exclusively a Basenji thing. It has popped up occasionally in other breeds, sporadically.
Okay.
What's also interesting is the age it can show up. I mean, we're talking anywhere from puppies just 10 weeks old to dogs that are, 11 years old.
Wow, quite a range.
A huge range.
Wow.
But focusing back on the Basenjis, the sort of typical age when owners start noticing clinical signs is usually between 4 and 7 years old.
Okay, so there's a peak time for them, which again points to that breed link.
It does. And no difference between males and females, apparently. No sex predilection.
Got it. So what are the clues then? What are the signs that might make an owner or maybe a vet start thinking, could this be Fanconi syndrome? What should you look out for?
Well, the earliest signs and the most common ones are increased urination, that's polyuria, and because of that, increased thirst, polydipsia.
Drinking more, peeing more.
Exactly. And this happens because when things like amino acids and glucose aren't reabsorbed, they stay in the urine and they basically pull extra water out with them.
Oh, okay. Osmosis at work.
Pretty much.
Yeah.
And it's important to know that, in the early stages, these might be the only signs you see. Your dog might just seem to need the back door open more often, or the water bowl refilled constantly.
Right. Easy to maybe dismiss at first.
It can be. But as the condition progresses, you might start to see other things. Weight loss is common, even if they seem to be eating normally.
Despite a good appetite.
Often, yes, though appetite can decrease later, too. Some dogs become more tired, lethargic, variable energy levels. You might notice just a general decline in their overall body condition. Maybe their coat doesn't look as good.
Okay.
And if it hits a young, still growing puppy, there's even the possibility of issues with bone development. Things like rickets could show up.
Wow. Okay. So those early signs, the drinking and urinating more, they're really key flags then.
They really are.
Yeah.
It's the kidney basically signaling that something's up with its filtering system.
That makes sense. Not just a quirky habit. Now, let's dig into the causes. We've talked a lot about the Basenji connection, the inherited aspect, but what else can actually lead to this kidney malfunction?
Right. So in Basenjis, the strong suspicion, as you said, is that it's inherited, passed down genetically.
But they don't know exactly how.
Not yet. The exact mode of inheritance,
Hmm.
the specific gene or genes involved,
Yeah.
that's still kind of a mystery. It's an area of active research.
Okay.
But then there's also what we call the acquired form. This means it develops during the dog's life because of external factors.
Things that happen to the dog.
Exactly. And there are a few known associations here that are really important for owners to be aware of. Certain medications, for instance.
Like which ones?
Well, gentamicin, which is an antibiotic,
That's word.
and even amoxicillin, a very common antibiotic has been implicated in some cases.
Really? Amoxicillin. Wow.
Yeah. There are also some experimental drugs, toxins used in labs like maleic acid, streptozotocin.
Hmm.
Those can cause it. And in rare cases, it can be linked to a condition called primary hypoparathyroidism.
Okay. And you mentioned something earlier that really stood out, the chicken jerky treats from China.
Yes. That has become a very, very significant concern, especially over the last, say, 5 years or maybe a bit more.
Right.
There's been a clear link established between dogs eating chicken jerky treats, specifically sourced from China, and then developing acquired Fanconi syndrome.
But they don't know what in the treats is causing it.
That's the really troubling part. Despite a lot of investigation, the specific toxin or ingredient responsible, it just hasn't been identified yet.
Mm.
So this is a critical piece of information for anyone giving their dog these kinds of treats. It's a tangible environmental risk factor, something owners actually have control over.
Absolutely. Really highlights the need to be careful about sourcing, doesn't it?
It really does. Know where your pet's food and treats come from.
Okay, so if a vet suspects Fanconi syndrome, based on those signs we talked about, how do they actually confirm it? What tests are involved in getting that definitive diagnosis?
Right. The diagnostic process is about ruling other things out and finding a very specific pattern of abnormalities, mostly in blood and urine tests.
Okay.
One thing they'll want to differentiate it from is something called primary renal glucosuria. That's where you also get glucose in the urine, even with normal blood sugar.
But Fanconi is more than just sugar in the urine.
Exactly. With Fanconi, the key difference is you also typically see other things lost in the urine that shouldn't be there, specifically amino acids. That's called aminoaciduria.
Amino acids too, got it.
Yeah, and usually a mild amount of protein as well. Plus, they often find a particular kind of metabolic imbalance. It's called hyperchloremic metabolic acidosis.
Okay, that sounds technical. What does that mean in simpler terms?
It means there's too much chloride in the blood, and the body's overall acid-base balance is off in a specific way, leaning towards acidic.
So seeing sugar and amino acids in the urine, plus that specific acid imbalance, those are the big clues.
Those are key indicators, yes. Now, when they run the standard tests, a complete blood count, the CBC, that's often normal.
Okay.
But the blood chemistry panel, that's where they look for other things. They might find low potassium levels, hypokalemia in about a third of affected dogs.
A third, okay.
That hyperchloremic metabolic acidosis we just mentioned is another big finding on chemistry. And if the kidneys have been struggling for a while, you might see azotemia,
Which is?
a buildup of waste products like urea and creatinine
Mhm.
in the blood that the kidneys normally filter out. Basically, a sign the kidneys aren't cleaning the blood properly.
Right, kidney function decline.
Exactly. And in those young, growing animals, they might also see low levels of phosphorus and calcium in the blood related to the bone issues.
Okay. And what about the urine itself?
When they analyze the urine, one of the first things is specific gravity. How concentrated is it? In Fanconi, it's usually low, meaning the kidneys can't concentrate urine effectively. Dilute urine.
Makes sense if they're losing stuff that holds water.
Precisely. Mild protein in the urine is common too. Sometimes they might even find ketones.
Ketones, like in diabetes.
Similar, but here it's often due to the metabolic state and the body trying to find alternative energy sources, not necessarily high blood sugar. And interestingly, in those cases linked to the chicken jerky treats,
Yeah.
vets often found specific things in the urine sediment, like granular or lipid renal casts, which are like little molds of the kidney tubules, and sometimes even bacteria.
That's specific to the jerky-related cases.
Seems to be reported more frequently in those, yeah.
Okay, that's a lot of info from those initial tests. Are there other, maybe more specialized lab tests they might run?
Yes. That hyperchloremic metabolic acidosis we keep mentioning, it's driven by losing bicarbonate, the body's buffer in the urine. That's bicarbonaturia.
Losing the buffer makes you acidic.
Exactly. And this usually makes the urine itself more acidic than normal, typically a pH below 5.5. This helps tell it apart from another kidney issue, distal renal tubular acidosis, or RTA, where the urine pH is often higher, above 6.0.
So the urine pH is a clue too.
It can be, though you usually only see significant bicarbonate loss. If there's enough bicarbonate in the system to begin with, sometimes they might do a bicarbonate loading test.
Okay. What about imaging? X-rays.
They can be useful, especially in young dogs. X-rays might show signs of rickets, or those angular limb deformities we mentioned, because of the poor mineral absorption.
Right.
In adult dogs, they might just see a general decrease in bone density, sort of like osteoporosis.
And to really, nail down the diagnosis, is there a gold standard test?
Well, for confirmation, urinary clearance studies are often the way to go.
What are those?
These tests precisely measure how much of certain things, glucose, amino acids, electrolytes, are being excreted in the urine over a set time. It quantifies the loss.
So you see exactly how much isn't being reabsorbed.
Exactly. It confirms that impaired reabsorption function. But, a heads up,
Yeah.
they usually advise against testing very young puppies, like under 8 weeks old.
Why is that?
Their kidneys are still developing, and they can sometimes have results that look like Fanconi syndrome, but actually aren't. False positives.
Ah, okay. Good to know.
And there's also a specific test, often used for suspected inherited cases, like in Basenji's. You collect a 24-hour urine sample.
The whole day's worth.
Yep, and send it off to a special lab, like the Metabolic Genetic Disease Testing Center at the University of Pennsylvania. They screen specifically for aminoaciduria, looking at the types and amounts of amino acids.
Very specialized.
It is. And it gives quantitative data. To give you an idea, in dogs with Fanconi, the percentage of amino acids the kidneys manage to reabsorb, the fractional reabsorption can be really low, maybe 50%, maybe up to 96%.
Compared to normal.
Compared to healthy dogs, where it's consistently much higher, usually between 97% and 100%.
Wow, that's a stark difference. Really shows the leakiness.
It really does. That quantitative difference underscores just how impaired the kidney function is.
And what if they looked at the kidney tissue itself? Like a biopsy? Does that show anything?
It can, yes, but these are typically later stage findings, not usually done for initial diagnosis.
Meh.
Under a microscope, they might see something called renal papillary necrosis, basically cell death in a specific part of the kidney, and also an unusual enlargement of the nuclei within the kidney tubule cells,
Yeah.
known as karyomegaly.
Karyomegaly, okay. But biopsies aren't routine.
Not usually the first step, no,
Hmm.
more for complex or advanced cases or research.
Got it. So this gives us a pretty clear picture of how Fanconi syndrome is identified. Once a dog does get this diagnosis, what happens next? What are the treatment options? How do you help manage it?
Okay, treatment. The very first step, especially if you suspect it's an acquired case.
Like from the treats or a drug?
Exactly.
Yeah.
Is to immediately stop whatever might be causing it. Stop the potentially offending drug, or absolutely stop feeding those chicken jerky treats if they've been part of the diet. Address any toxin exposure.
Makes sense. Remove the trigger.
Right. But for dogs with the inherited form, like many Basenji's, it's really crucial to understand that the underlying problem, the faulty transport mechanisms in the kidney tubules,
Well,
that can't be reversed.
so you can't fix the leak itself.
You can't fix the leak itself.
Yeah.
So the focus of treatment shifts. It becomes about managing the consequences of those defects, trying to maintain the dog's quality of life despite the ongoing losses.
Managing the symptoms and imbalances.
Precisely.
Yeah.
And because the specific substance is lost and how severely they're lost can vary quite a bit from dog to dog.
It's not one size fits all.
Not at all. Treatment really needs to be tailored, individualized for each dog based on their specific lab results and clinical signs.
Okay, so what are the main things they try to manage?
Well, one of the most common and critical things is managing that metabolic acidosis, especially if the blood bicarbonate level drops quite low. Usually the trigger is below 12 MEQL.
Right, the acid buildup.
Yeah. And because these dogs are losing so much bicarbonate buffer in their urine, they often need relatively high doses of alkalinizing agents to help get that acid-base balance back towards normal.
Alkalinizing agents, like baking soda.
Sodium bicarbonate is one, yes. Potassium citrate is another common one. The goal is usually to keep the blood bicarbonate concentration in a target range, typically between 12 and 18 milli-UQL.
Okay.
And for those young, growing animals who might have the bone development issues,
The rickets.
right, they might also need supplementation with vitamin D, calcium, and phosphorus to support bone health.
Are there specific medications then that are commonly prescribed? You mentioned potassium citrate and sodium bicarbonate.
Yes, those are the mainstays for the acidosis and electrolyte issues. Potassium citrate helps replace lost potassium and also has that alkalinizing effect.
And the dose varies a lot.
It really does. It can range anywhere from 50 up to 500 milligrams per kilogram of body weight, usually given twice a day.
Wow, that's a huge range.
It is. And sodium bicarbonate is used as that direct alkalinizing agent. The typical dose there is 80 to 300 milligrams per kilogram, given maybe 2 or 3 times a day.
Okay.
And it's really important for owners to realize These dosages are often much higher than what vets would use for other kidney problems,
Hmm.
like that distal RTA we mentioned earlier.
Because they're losing so much buffer.
Exactly. They're fighting ongoing significant losses. Just for reference, about 1 millieq of potassium citrate is 108 milligrams,
Mhm.
and 1 millieq of sodium bicarbonate is around 84 milligrams. The vet uses regular blood tests to carefully monitor things and adjust these doses.
Right, constant monitoring is key. Are there any medications or treatments that should absolutely be avoided in dogs with Fanconi?
Yes, definitely. You absolutely want to avoid any drugs known to be toxic to the kidneys, nephrotoxic drugs.
Makes sense. Don't stress already struggling kidneys.
Exactly. And also avoid any medications that have the potential to cause Fanconi syndrome themselves, which brings us back to that list we discussed earlier, like gentamicin.
Right.
Also, because these dogs often have high chloride levels in their blood, that hyperchloremia, it's generally better to avoid using potassium chloride supplements if they need potassium. Potassium citrate is usually preferred.
Ah, because the citrate part helps with the acidosis too, and you avoid extra chloride.
Precisely.
Okay. So once a treatment plan is in place, what kind of follow-up care and monitoring is needed? How often are they seeing the vet?
Well, in the initial stages, when they're first starting treatment and adjusting doses, monitoring needs to be quite frequent, usually checking blood chemistry every couple of weeks.
Okay.
This is to see how well the medications are working. Are the electrolytes balancing out? Is the acidosis improving? They'll pay really close attention to potassium levels.
Why potassium specifically?
Because the bicarbonate therapy, while needed for acidosis, can sometimes actually cause more potassium to be lost through the kidneys. So you have to watch that carefully.
A balancing act.
A real balancing act.
Yeah.
But once the dog's condition has stabilized and they're on consistent doses that seem to be working,
Then what?
then the frequency of those monitoring blood tests can usually be reduced, maybe checking every 3 months or so, just to make sure things are staying on track.
Okay, that's manageable long-term. And looking ahead, what's the typical long-term outlook? The prognosis for dogs diagnosed with Fanconi syndrome?
It's quite variable, honestly. The clinical course can really differ from one dog to another.
How so?
While some dogs, with consistent and appropriate management, can remain relatively stable and maintain a pretty good quality of life for several years.
That's good news.
It is. But for others, unfortunately, the condition can progress much more rapidly. They might develop significant kidney failure within just a few months, despite treatment.
Oh, wow. So it can go either way.
It really can. And sadly, the most common cause of death in dogs that don't do well is acute renal failure, often complicated by that severe metabolic acidosis we talked about.
Right.
And there's another thing to be aware of, a potential long-term complication. One study found that a significant percentage, around 18%, of dogs with Fanconi syndrome went on to develop seizures or other neurological signs several years after their initial diagnosis.
Neurological signs, too. That seems unrelated to kidneys.
It's not fully understood why, maybe related to chronic electrolyte imbalances or metabolic changes, but it highlights potential long-term issues beyond just the kidneys themselves.
So it's a condition that definitely requires ongoing vigilance, careful management, and the outcome can really vary.
Absolutely.
Okay, so to kind of bring it all together then, the key takeaways from this deep dive into canine Fanconi syndrome seem to be it's fundamentally the kidneys losing their ability to properly reabsorb essential stuff.
Right, the good stuff gets lost.
There's a very strong genetic link, especially in Basenji's, which is still being figured out, and worryingly, a clear association with certain chicken jerky treats, where the toxin is still unknown.
Yeah, those are major points.
Diagnosis involves looking for that specific pattern in blood and urine, the sugar, the amino acids, the acidosis. And treatment isn't a cure for the inherited form, but focuses on managing those resulting imbalances with medications, supplements, and really careful ongoing monitoring.
That sums it up well.
It's definitely something that dog owners, particularly if you have a Basenji or if you use jerky treats, really need to be informed about.
Absolutely. Awareness is key.
And that really leads to a final thought, doesn't it? You know, considering that the exact culprit in those chicken jerky treats is still unidentified,
Yeah.
and the precise way Fanconi is inherited in Basenji's is still unclear, it really makes you think, what further investigation is most critical right now? What kind of research do you believe would be most beneficial in, well, protecting our dogs from this really challenging condition?
Yeah.
Something for you, the listener, to think about.